or you decide who to fire. I forgot to start recording. So anyway, so where was I? Proximal. So for proximal, I like to think about proximity. Okay. What's proximity? Hello?
Closeness.
Yeah, being close. So my mouse is in proximity to my hand, so I could chuck it across the room because I forgot to start recording. So I apologize for you guys, but it was easy stuff. So proximal, proximity. So proximity to that point of attachment. So this part of the forearm, and it also applies to the humerus, to the thigh, or to the arm, to the thigh. This is the proximal forearm. Now, the opposite of proximal is distal. So the way that I remember distal is I think about distance, right? Further away. So if I'm talking about the further away from the point of attachment or the midline, what part of my forearm would this be?
The wrist.
No, this is my wrist. I'm talking about the forearm. If this is proximal, then this is what?
Distal.
Distal. So this is my proximal forearm. This is my distal forearm.
Oh.
This part in the middle would be, what do you think?
Medial?
Medial. Awesome, Santana. I heard you say it first. You bolded first, so. Yeah, it's my medial forearm. So proximal forearm, medial forearm, distal forearm. So if a patient has an injury to the forearm, well, where in the forearm? Oh, the patient has a injury, a crush injury to the proximal forearm.
And that's just going based off of the elbow, right?
Yeah, the point of attachment. I like to call it the point of attachment. But some people will say it's, is it further or closer away to the midline?
Oh, all right, I got it.
Okay. So proximal, distal. The other one, and we talked about inferior, right? Up above, towards the head, inferior, down below, towards the feet. All right. We talked about minutes. We talked about that. Okay. So the last one, or kind of the last one, is medial lateral. All right. So medial means towards the middle. And in this case, it's towards the midline because that's the middle of the body. So medial, towards the middle. But, so I could see myself again. I love seeing myself on TV. Not. So we're going back to the forearm. Okay. So you see where it is. There's my armpit here, my elbow. Here's my thumb. Okay. So remember, as I'm standing tall, my arm would be, okay, there's the palmar surface of my hand straight out. So as I'm bringing it in. Okay. So you see that? So this inner part here, it's towards the middle, right? Towards the inside. So this part is considered the medial aspect of my forearm. And again, so you can see the reference, palm, back of hand. So this is the medial part of my forearm because it's towards the middle. Whereas the outside of my forearm, because it's away from the midline, a quarterback throws the pass to the side behind the line of scrimmage, what kind of pass is that called?
Lateral.
A lateral. So lateral off to the side is the way that I remember it. So what do you think this side of my forearm is called?
Lateral forearm.
Yeah, the lateral aspect of my forearm. So again, I suffered an injury to the medial aspect of my proximal forearm. So where's my injury? Tell me when to stop.
Say it again.
I said I suffered an injury to the medial aspect of my proximal forearm. So tell me when to stop. If you're seeing young,
Stop.
okay, good. Actually, I should have gone like this and then tell me, all right, slow down. I go in, go out, whatever. But yeah, it's right here, the medial aspect of my forearm. So can you see how descriptive all that gets? And how you're painting a better picture?
Yep.
All righty. What else? All right, so palm, or like the palm of your hand. So for those of you that speak Spanish, what's the las plantas de los pies?
The bottom.
Yep.
Your feet.
The cool thing about medical terminology is that there's a lot of words that are based in Latin. And Spanish being part of Latin, guess what? It makes it easier. So just thought I'd share that with you guys. All right. So las plantas, plantar, refers to the soles of the feet. Okay. Like, have you guys heard the word plantar fasciitis?
Yes.
And do you know what it is?
When the foot's really flat, like it doesn't have the curve.
Nope. Well, it might
it's
not
just the
have
other
a
way.
curve, but no, plantar fasciitis is inflammation of the fascia, the layer or the tissue that encloses the muscles in the feet. So when you have a lot of pain at the soles of your feet, that's plantar fasciitis. All right. Oh my gosh, naked women. Close your eyes, young people.
Matthew.
Oh crap! Wait, do I have high school students in here? I do. No, I don't. Yeah, I do. If you're in high school, close your eyes.
Matthew.
Is Matthew in high
What
school?
do you mean? No, I'm not in high school.
I should have gotten a parent's note from his parents that he could watch this picture. We'll make him get one when we talk about OB obstetrics.
Parents.
So, no, it's medicine. We're medical professionals. Oh, I haven't given you my spiel, have I? I'm out of sync. Guys, here's my spiel for you guys. That sounded weird, but because you guys are studying to be EMTs, EMTs are medical professionals. I am going to treat you as such, as medical professionals. Number one. Number two, even though I am a paramedic, I do not believe that I am better than you. You will notice, and I'm sure you already have many times, when I talk about EMTs, I will say I or we. We as EMTs, okay? I put myself in your shoes. I will never ever make you feel like I am better than you, because I am not. Okay. As far as I'm concerned, we are equals, and I will treat you as such. That promise I make to you. Okay. So you'll never feel like I'm putting you down. You're an EMT student, or you're going to be an EMT, or once you become EMTs, that you are EMTs. Okay. So that's my spiel. All right. So as far as regions of the body, regions like, you know, how we have Appalachia, we have New England, we have the West Coast, we have Texas, we have the South, the Southwest, the Southeast, all that good stuff. The body also has regions, but they're a little bit more descriptive, I think. Okay. As far as the regions of the body, it's to help us know which part of the body to go to. So the first one is the head. We have the head, and it has two regions. The occipital region, well, actually has a lot of them, frontal, occipital. It really pertains to what part of the body, or like bones, usually bones or anatomical areas. So it pertains to the neck, because the bones in the neck are called the cervical spine. The occipital region, that's the back of your head. If you feel the back of your head, you feel that bump back there, that's part of your occipital bone. So that's why they call it the occipital region. So the big basketball sized thing on top of your shoulders, that's called your head. And then the head also, we have the face and the skull. The face right here, and then the skull is right here. Okay. You have your neck, and then you have your torso or your trunk. It's basically from your shoulders down to your pelvis. That's your trunk. Now your trunk, you divided, you have the chest, the abdomen, the back, and you could further say the thoracic region, which is the chest. If you say the thoracic spine, just remember that the next set of vertebrae, the bones in your back, are called the thoracic vertebrae. Okay. So thorax, that's your chest. The thoracic region could be the back because of the thoracic vertebrae. Scapular region, because of the scapula, the shoulder blade is called the scapula. But keep going past the thoracic is the lumbar region, which is your low back area. And the reason it's called lumbar is because the bones in that part of the spine are called the lumbar vertebrae. So your low back is actually your lumbar region. Now, right in here, let me get my laser pointer so you don't think I'm doing anything hokey. All right, so this is your lumbar region right here. Now you see this right here, it says iliac crest, right in here. The iliac crest is the pelvic bone. So that bone you feel up, that where models, really skinny models, they have that bone that's sticking out, they're up in the pelvis. That's your iliac crest. Okay. So right in here. All right, so cervical, head, all that, the skull right here, the face, the neck, the shoulder, the arm. So the humerus, that's the bone right here, is the arm. You have the elbow, you have the forearm, the wrist, the hand. Okay. You have the chest, you have the abdomen, you have the umbilical region right here because of the umbilicus, the belly button. You have the pelvic area right in here. You have the genital area right there. Got the buttocks, hip right in here. Now, the arm, forearm, elbow, wrist, hands, that consists of your upper extremity. and you have two upper extremities. Okay, 1, 2. Shoulder, arm, elbow, forearm, wrist, hand, fingers. Now, if you have an upper, do you think you're going to have a lower?
Yes.
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 And so the leg, this is no longer your leg. This is your lower extremity. Okay. And the lower extremity consists of the hip, the thigh, the knee, the leg, the ankle, the foot, and the toes. So, guys, don't call this the inner thigh anymore. What part of, what aspect of the thigh is this right here?
The femoral. No, hold on.
The what?
The femoral region? No.
Region?
Well, no, the femoral is because of the femur, the thigh bone. It's
Oh.
called the femur, so it's saying the femoral region. But earlier I talked about this aspects. So what aspect of your thigh is this? It's not the inner thigh anymore, huh?
Medial?
No,
Distal.
medial.
Oh,
Nope.
the proximal.
No, this is the medial
Medial.
aspect of the thigh. Now, this is the proximal thigh, the medial thigh, and the distal thigh. Same
Alright,
thing,
I got it.
proximal leg, medial leg, distal leg, and then you have the ankle. Popliteal one because you have the popliteal artery back in here. Posterior tibial is an area that also has a pulse. So tib fib, so posterior tibial, you'll actually find it right in here, behind the tibia, like between bone and the Achilles tendon right in here. So see, that's one thing you could do with your kids or your significant other is palpate their pulse points. Carotid, brachial, right in here. Femoral, popliteal, posterior tibial, dorsalis pedis. The dorsalis pedis, the dorsal of the foot, like the spine of the foot. Carotid, brachial, radial. Said femoral, popliteal, posterior tibial, dorsalis pedis. Those are the arteries that the arterial points to measure a pulse. So you're gonna have to know those. Do you need them again, or did you guys write them down?
Again, please.
CAROTID. Next is brachial. BRACHIAL. Then you have radial. RADIAL. Then femoral. FEMORAL. Then you have popliteal. POPLITEAL. Then you have POSTERIOR. I gotta think about it.
What is it again?
Posterior. POSTERIOR. Tibial. TIBIAL. And then the last one is dorsalis, DORSALIS, pedis, PEDIS.
It's the ice machine.
All right. So there's that midclavicular line I was telling you about, the anterior axillary, and where that's important is if you work with an advanced EMT or a paramedic, there might be occasion to do a 12 lead. And if you ride out with me on an ambulance, and we get a call for chest pain, then you are going to help me out with a 12 lead. Okay. And so one of the lines that you have to remember is the anterior line. So remember the mid axillary right through the middle of your armpit. The anterior axillary now is the front part. So you have the axilla right here. Okay. This area. So anterior would be right here. The anterior axillary line, and then the posterior axillary line. But you would do it in posterior, anterior and mid axillary. Oh, I forget. You guys can't see my camera when the PowerPoint is up. I'm sorry. Estoy pendejo. Or can you see me on camera?
Yes.
Oh,
Yes, you
okay.
can.
Because I have
A
another
little
class.
bit, but you're like super, super.
I'm super what? Handsome? What?
It just looks smaller.
Okay. No, I had another class tell me, no, we can't see anything. So see what happens when you assume. I just made an ass out of me. All right. So, well, I'm glad you guys could see it. All right. So I talked about the clavicle. The acromion, you don't really need to know about the acromion. That's just part of the scapula. The suprasternal notch, that's getting, huh? Oh, that's just getting a little bit too much. The one thing I didn't tell you guys is that if you really want to learn about the human body, really get in depth with A&P, take a college A&P class. Here, we're just doing a broad overview. We don't get really into it. I do with respiratory and cardiac because they are important things to know. But I'm not going to get so in depth with most of the human body. You got to remember, I was an X-ray tech for several years. So part of my schooling was learning about the different parts of the bone. So like the sternum, your breastbone is called the sternum. So you have the suprasternal notch, supra meaning above, and sternal is sternum. So the little indentation up here, that's the suprasternal notch. And then as you start going down, you feel a bump. Well, that's called the angle of Lewis. And then you have the manubrium, the top part of the sternum. You have the body of the sternum. And then you have the xiphoid process, which is the bottom part of the sternum. On the scapula, you have the acromion process, you have the acromion, you have the glenoid fossa. So there's a lot of different little things that you can learn. But we're not going to get that intense. You're not going to have a question on an exam or a quiz that says, what is the bump on your sternum called? Who really cares as an EMT about the angle of Lewis? Okay. But and these pictures are your are in your book. So, all right. Okay. So there's your scapula in the back. Remember, we talked about the spine, and we'll talk a little bit more about it when we get to the musculoskeletal system. The spinous process. If you've seen somebody skinny, but somebody that is not very muscular in the back, and you see the little bumps on their back. Have you noticed that?
Yes.
Okay. Those little bumps are what we call the spinous processes. And that's just as the back end of the vertebrae. Okay, so these little things right in here. And on Monday, if I can find Homer, I will show you the spinous process of the spine. And if we were in class, Homer, he's our skeleton. I named him Homer. I use him different things. Okay. So, all right, lateral chest, like I talked about. Remember, I showed you anterior axillary line, mid axillary line, posterior axillary line. Blah 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 blah. Okay. So a little bit more topographic. We already talked about the upper and lower extremities. We talked about the, what's this part called?
Which one? What part?
Oh, this. Let me draw it out for you.
Torso.
That part.
Medial.
Torso. Yeah, that's the torso or the thorax, right?
Thorax.
Yeah. So
Torso.
torso, Torso,
So.
not tesoro. Torso. All right. ¿Qué más? ¿Qué más? ¿Qué más? All right. You see all these little things, and you know, eventually, little by little, and we will talk about different areas, like the radius, the ulna. You don't need to know the greater trochanter. Symphysis pubis. We'll talk about that when we talk about OB emergencies. The thigh bone is the femur. The patella is the kneecap. You have the two bones in the lower leg, the tibia and the fibula. Okay. Tibia is on the inside and it's bigger. Fibula. I'm not saying this is what I came up with. This is the way that I was taught. Think about F as in female, and females are smaller. So when you compare it to the fibula, compare it to the tibia, it's all that, whereas the fibula is just a little bone over here on the side. And you know the bones also because you know those bumps on your ankle?
Yes.
You have them both on the inside and the outside of your ankle?
Yes.
Those are called right here, malleolus. And so the one on the inside of your ankle, what do you think that one's called?
Medial malleolus.
There you go. And on the outside?
Lateral
Man,
malleolus.
you guys are awesome. I am impressed. You guys are. Did you already know this from before,
Spicy.
Miss Santana?
Yeah, I took AMP 1 when
All right.
I first went to UTEP.
Okay. You see, knowing the body. But yeah, medial lateral. But for everybody else, did you see how that works? We know medial and lateral, and we know that's called the malleolus, that bump, and we have two of them. So we have a medial and we have a lateral.
To one each.
One on each side. And then, so that was the left lower extremity. Now on the right lower extremity, we have two more malleolus. And what do you think they're called? the medial and lateral malleolus. There's 216 bones in the body. Name every single one of them, which sucks. Okay. So we talked about upper and lower. Here are your organs. And again, we'll cover the larynx. We're talking about the heart and the lungs today. Oh, no. Heart on Friday, lungs today. The trachea, the larynx today. We'll talk about the stomach, the kidney, the spleen, the intestines on... No, actually, some of those we'll talk about today. And the hollow and solid organs. So, all right. You guys having fun?
Yeah.
You learning a lot?
Say hi, Lou.
Hi, Miss Velvet.
Oh, no, they just.
Oh, labeling.
Yeah.
Okay.
I'm going to mute you for a minute, Miss Columbia. Because everybody else can hear your conversation. All right. All right. Are your hands getting tired from all the note taking? No? Okay, I'm going to keep on going then. Tire you guys out. Oh, I wish I so want to do CPR with you guys. I'm not going to give anything away, but oh, I'm so looking forward to doing CPR with you guys. Cavities. Cavities are areas of the body that are kind of hollowed out, and organs go in there. Don't put too much emphasis on the cavities, but have a general idea. For example, if I talk about the thoracic cavity, well, thoracic pertains to the chest, right?
Yes.
So what organs can you think of that are found in the chest?
Heart and lungs.
Yeah. And then we get down to the diaphragm, and that's the border between the thoracic and the abdominal cavity. And so what organs do you think are found in the abdominal cavity?
Your stomach, your liver, pancreas, large intestine, small intestine.
Exactly. And then we get into the pelvic cavity, where you have reproductive organs and the bladder.
Your genital.
So cranial cavity, where your brain sits, spinal cavity, where the spinal cord is. So it's pretty simple. I wouldn't spend too much time. I mean, it's just really cranial, thoracic, abdominal, pelvic, which consists of the abdomen and the pelvic cavity. Pretty simple. All right. So the last one, and I'm trying to and I wish I didn't have all this in front of me, because I like to do my drawing. But I'm going to do it here where I have white. Okay, so as far as abdominal cavity, the reason we need to go over the abdominal cavity is because there's a lot of stuff inside the abdominal cavity. And when you say the patient has abdominal pain, what are you thinking about? What's the problem besides having abdominal pain?
Intestinal problems. Gastrointestinal.
Yeah, it could be intestinal problems. And now when I hear the word intestinal problems, I think about the large and small intestine, or large and or small intestine. But there's more to it than just the large and small intestine. So we need to start becoming, we need to start being more specific, because I'm here to tell you, and it's meant as a joke, but it's not meant as a joke, it's to prove a point. So please don't get mad at me. But women are complicated. Are you not, ladies? The reason I say that, and I said it's trying to prove a point, is a woman of childbearing age complaining of abdominal pain. Do you know how many different possibilities there are? Exactly. Now give me a number.
Give you what you said?
Give me a number as to how many different possibilities there are for women women of childbearing age complaining of abdominal pain.
Over 7?
Oh, a lot more than 7. Sorry.
They give you a number.
Yeah, but it's all 7.
Mm,
20?
Higher.
Ay, wait.
52.
Exactly. Higher.
100.
108. More than
Higher.
100.
Yep.
500.
More than 100.
200.
Higher.
456.
Oh my goodness.
Higher.
1,000.
Higher.
Whatever.
I'm done. I gave you all my lucky numbers.
About 10,000 different possibilities.
Cool.
Pregnancy, ectopic pregnancy, endometriosis, endometriosis, PID, what else? STD, and you got the different types of STDs: chlamydia, gonorrhea, AIDS, the clap. What else? Kidney stones, intestinal blockage, cholecystitis.
UTI.
Yeah, UTI and yeast infection and what else? I mean, I'm not going to name all 10,000 things, but you see what I mean? So there's a lot of different possibilities. So we have to be specific, okay? Now, what would you think if I tell you the patient is complaining of right lower quadrant pain?
Appendicitis.
Appendicitis.
Do you have to specify? Like
On what? Specify what?
Oh.
Got a hot mic. Oh yeah, you mute yourself now. I see how it is.
Lou.
No. Huh?
I have a question.
Yes.
So like I was looking at the midline area on page 136 on the next page after this. And like I was wondering, if we go to a call, do we have to specify on like exactly where on what part of the liver, like because of the midline area? You know how it says liver small portion and then there's liver majority? Do we have to specify?
No, because it's going to be difficult to determine, and when we deal with abdominal emergencies, we're going to see what happens in the layers and stuff. But no, it's going to be hard for us to really determine what part of the liver. They'll have abdominal pain, and they could have what we call deferred pain or referred pain, which means that they're going to have more other than where the organ is.
Okay.
So no, we don't have to specify.
Okay, thank you.
Okay. Still got 30 minutes. Cool. All right. So going back to my drawing. So what does quadrants mean?
Sections?
Areas.
4 sections.
Okay. Yeah. 4 sections. Quadrants, quad meaning 4. So the abdomen is divided into 4 areas, as you can kind of see right there. Now, this point right here, that's our jumping off point. So we have the abdomen. And the jumping off point, although it's too little, but I can kind of put a little bit of belly lint in there. No, I can't draw a straight line. Leave me alone. I failed that subject in kindergarten. So the center point, like the 4 corners, is the belly button. And as we're looking straight on, what side of the patient is this?
Right side.
The right side.
The upper right.
Hold on a sec. All right. Side is
Left.
left. Okay. Now, for whatever reason, they don't call it superior and inferior. They just call it upper and lower. So what is this area called?
Upper right quadrant.
Right.
So that's a U. And what's this here?
Lower right. Right lower quadrant.
Right lower and left lower. And they're quadrants, so it's a Q. So LUQ, LLQ, RUQ, and RLQ, right lower quadrant, okay? So that's the jumping off point. Quadrants, right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. All right. No, wrong one. Chihuahua.
What will you know about it? You shouldn't be running any calls anymore until your doctor clears you.
I can hear her.
Sorry, let me mute it.
Don't worry, I'll give her shit tomorrow. I'll make her tell her I'll make her test extra hard. All right. So we talked about the quadrants. So the reason I'm spending this time is that you need to know
You just got out of class. You just got out of class.
you need to know which organs are in which quadrants. Okay? So, first off, our liver. Liver is considered a right upper quadrant. Even though we have a little bit of our liver on the left, it's still a right upper quadrant organ. Okay? Now, normally in class, I would have you guys draw this out. Underneath the liver, right in here, is the gallbladder. Then we have the stomach. It's a left upper quadrant organ, but it does go into the right side. Okay. So there's the stomach. Underneath the stomach, we have the spleen. Over here, we have the pancreas. Now, the pancreas is considered a right upper quadrant organ. So it initiates over here, but most of it is found left upper quadrant. All right, you guys seen that so far? Somebody nod, tell me they hear me.
I hear you.
Okay. Oh, okay. All right. Now, where's the large intestine at? Actually, strike that. Where's the small intestine at?
Left lower
The
quadrant.
left lower.
This is the
No,
small
contrast.
intestine. So it starts here and it goes do 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 do, and then it gets to intestine. So it goes up, goes across, goes down, and then it goes and then it gets to the rectum, and then the anus, and you go take the kids to the pool. Those are the kids in the pool. That's the water.
Cute.
Right here, where the large intestine goes, we have the appendix. What's the appendix do?
Kind of filters.
It filters what?
Maybe
Fats? No,
Nope,
right?
that's the liver.
Oh.
The liver junction. It doesn't do anything. It just sits there. It's kind of like that relative that comes in, moves in with you, and doesn't do anything. You got to support them. Like Cousin Eddie and the National Lampoons movies. You guys are too young to watch those movies. Never mind. I got to start creating my list of movies that I assign to students so they know what I'm talking about. Anyway, so the thing about the intestines is that they're found in all four quadrants. You really don't have any other organs besides the intestines. Okay. Now, something else about the organs. We have hollow organs and we have solid organs. A hollow organ is hollow on the inside, and they usually contain a fluid or something. Like the bladder is a hollow organ, so it contains urine. The intestines are hollow organs; they contain what eventually becomes stool. The stomach is a hollow organ, and that's where the food collects, and it gets broken down, and then it's moved along. Okay. Now we also have solid organs, the liver, the spleen. What makes them unique, solid organs are very vascular. In other words, they have a lot of blood vessels. They contain a lot of blood. Now, the reason that is important in the future with blunt force trauma, such as a punch to the stomach, a baseball bat, and I don't mean stomach as in the organ, I mean stomach as in the abdomen, and I should use abdomen. blunt force trauma to either the right or the left upper quadrants, we have to think about an injury to those respective solid organs. So if there's a blunt force trauma to the right upper quadrant, what organ are we going to think about?
The liver.
The liver. If we have blunt force trauma to the left upper quadrant, what organ are we going to think about?
Stomach or spleen.
The stomach is hollow.
Spleen.
It would be the spleen. Those get injured very easily with blunt force trauma. So if you have a patient that suffered blunt force trauma to the upper quadrants, you got to think about either liver or spleen injury. Want to hear a quick story?
Yes.
I heard somebody say, yeah. So years ago, I was actually at the station teaching a class or something, and a call dropped. So I went on the call. And I was trying to remember if I was a captain or a battalion chief already. So I went in the staff vehicle, and I get there, and the captain of the engine's like, Lou, hey, can you take care of that guy? He's complaining of chest pain. So I go assess the guy, and I ruled out cardiac chest pain. In other words, he wasn't having a heart attack. The guy and his wife were riding motorcycles. I don't remember if they each had their own or she was riding with him. And they were involved in an accident. And so the guy hit his, what I thought was chest. And I didn't see any bruising on the chest. I didn't suspect a heart attack or anything like that. But I'm assessing him, and he starts complaining a little bit of abdominal pain. And I've been accused of being very observant. I notice little things, and you would be surprised at the little things that I notice. Okay. But I've been training. I've been a paramedic for almost next month. In June, it will be 20 years that I've been a paramedic. Yeah, since 2000. So I've been doing this a long time. And I'm observant. And I kept noticing that the guy's stomach looked like it was getting bigger. And I saw a small little bruise over the right upper quadrant. And I have an EMT with me, and she happened to be a previous EMR student of mine. And then she says, and again, I forget what rank I was. It's like, hey, I don't remember if she called me cap or chief. Hey, does it look like his stomach is getting bigger? I'm like, yeah. So, okay. And that little bruise, and so I said, sir, you've seen your abdomen recently? Yeah. Do you have any bruises on your abdomen that you know of? No. And the reason I ask, and because I shoot up insulin, I sometimes get bruises on my abdomen from that. So I wanted to rule that out. And he's like, no. Okay, so cool. Well, that little bruise was bugging me. So we packed him and his wife. This guy's going to be a major trauma. Something is bugging me, so I'm going to make him a major trauma. So we called out 2 ambulances, and they got there because we didn't transport. So ambulance showed up. I'm like, this is patient number 1. She's patient number 2. However, he's a major trauma, so he needs to go now. So they took him to the hospital. They took both of them to the hospital. She wasn't too bad. Come to find out, the guy suffered a lacerated liver. Somehow he got struck in the abdomen and injured his liver, and he was bleeding out. And when we talk about bleeding, we'll learn that internal bleeding, you might not see it for quite a while, the bruising. So it's just something that bugged me about him that made me say this guy's a major trauma. And sure enough, it worked out pretty good on his behalf. He had a major liver, and off he went. So this is why I tell you, or not just why, but this is why I tell you, you need to know what organs are in which quadrants. Now you see on there that talks about the kidneys. But did I mention the kidneys before this?
No.
No, I didn't. And why is that? Because the kidneys are not considered abdominal organs. They're considered retroperitoneal. Retro meaning behind. So they're more located in the back. Okay. All right. You see midline bladder, uterus. Uh-huh.
Is the heart considered a hollow organ?
Kind of, but we don't really refer to it as a hollow organ. The heart is the heart. So we're worried, and when we talk about it on Friday, we'll learn why it's a special, unique structure organ. All right. Do you guys want to take a break now? Because as you've kind of learned, I'm a little ADD or OCD. Well, both. Now I don't like to start something without finishing it. So I don't want to start on the musculoskeletal system and then have to pause halfway. But if you guys want to do it, I'll suck it up, buttercup, and move forward.
We could take break now.
Break now.
You're trying to let your brain absorb all this stuff?
Yeah.
Yes, a little bit.
I just like the person who's like, yeah. All right. I have almost 7:50. So 20 minutes?
How much? 20.
20.
Mhm.
Okay. Awesome.
So be back at 8:10.
Yep.
Okay.
Yes.
Alrighty, I'll see you guys back at 8:10.
Bye.